welcome to the Dr. Julia Sen Health and Wellness podcast. I'm Dr. Julia Sen, and today I'm going to be talking about a subject very close to my heart, skin cancer. Skin cancer is the commonest human cancer, and unfortunately, despite improved skin safety awareness, new cancer diagnoses are increasing year on year, and this has been the case for several decades. Skin cancer is something that I'm heavily involved in, both in my NHS and private practice, operating on approximately 100 cases per year. Today, I'm going to be talking to a lady who has been through a journey of skin cancer, and I've been involved in that journey with her. So today, I'd like to welcome to the clinic, Jane Wendel.
Hello, nice to meet you.
Oh, welcome to the clinic, Jane. It's so lovely that you're here. First of all, I'd like to say the journey that you've been on, and we've talked a little bit about this because I was part of that journey. We reconnected because a few months ago when the weather started getting hot, you did a really brave and generous thing, and you posted photographs of your journey on Facebook, and you did say that it had been a difficult thing to do and it had taken you several years before you felt ready to do that. So I wanted to say thank you so much for doing it, because I think people don't always necessarily realise what it is and how it can affect you. And this is also very personal to you. So I'd like to, if it's okay with you, start right at the beginning, the very first thing that you noticed before you started your journey.
Okay, so I didn't actually go to the doctors for the lesion that I'd got around my eye where the skin cancer was. It was a little lesion that I'd got on my forehead, and a colleague had said, oh, you should go and get that sorted. So I went along and she said, no, that's fine. And I just said, oh, while I'm here, I've got this funny little thing on my eye that blisters up, heals up, comes back, I said, and then re-blisters and bleeds. But at not any point did I think it was skin cancer. And I'd had it for about 2 years. And this just kept happening. So she's all a little bit more concerned about that. So she had a look at it. Still, I didn't feel her words. I'm a little bit more concerned. Felt like it was skin cancer. I actually missed my next appointment, which was with a dermatologist. And they rang me and they went, it's really important that you go to this appointment. So they rearranged it and off I went, and it was a Sunday afternoon. It was the 6th of September, I remember it really well. And I walked in and I sat down still thinking he was going to give me some cream or give me something to help this lesion that I'd got on my eye. And he just said, oh, I'm sorry, well, he actually didn't say sorry even. He said, you've got skin cancer. I'm going to send you to see a plastic surgeon. And that was it. And I kind of sat there, absolutely flabbergasted, thinking, he didn't say it was basal cell, he didn't say anything. So that was the start of my journey. So
A shock.
A real shock, yeah. I was just not prepared at all for the words.
And was there any more information given to you about what might happen?
No, and that was it. And off I went. And then luckily you were my consultant. So thank you very much for that.
Very welcome. So you would have come to see me and we would have talked about the next steps. So I'm going to let you talk about your experience of what the next steps were.
Okay, so then I came to see you, and then you told me it was a basal cell carcinoma. And a lot of people said, well, that's not cancer. It's not skin, you haven't got cancer. So, and again, I was questioning myself, and they said, don't Google, just don't Google anything, which of course you do then. You go and Google, and I think, no, mine isn't going to look like that. It's going to be fine. And then you were really good with me. You told me that I was going to have the skin taken away from the eyelid, and then you would use that skin to cover the lesion. Still, I was still being really positive, thinking it's going to be fine. In 2 weeks after the surgery, I'm going to be fine. You were brilliant. You walked through all the steps with me. Absolutely brilliant. And it was on the NHS when you performed the procedure for me. Then I met you at the Alex, went in, still not quite prepared for what was going to happen. Came away, and I think I have sent you the photographs where I go in with my mask on at the time, come away with a big patch on my eye. And I think that's when it really hit me that actually it was something pretty serious.
Yes, because usually so basal cell carcinoma is the commonest of the skin cancers. Thankfully, it's the one, if you're going to get one, it's the one to get, because it doesn't seem to know how to spread anywhere else, but it will continue to grow in that site. So the earlier that it's picked up, obviously, the better. And with these skin cancers, what we would normally do is we see where the lesion is by the naked eye, as it were, and then we'll measure a margin all of the way around and remove that abnormal bit with a cuff of normal looking tissue, because we know there's some roots being put down and we want to try and get all of it, and then it goes off to the lab. The tissue is processed and the pathologists interpret it, and then they will give a report and they'll say, confirm what it is, which in your case was basal cell carcinoma, and then they will say how many millimeters it is from all of the margins. It's really important to get peripheral and deep clearance, so we always allow for that. I tend to do my repairs at the same time, so you would have had one procedure. So how long did the procedure take? Can you remember?
Not very long, I think 20 minutes. No, it was a little bit longer, because I think the blepharoplasties take 20, don't they?
Yes,
so I think it would have been longer, but it was really relaxed. You were all chatting. You know, it was a really relaxed atmosphere, so that was helpful for me at the time, that you were all really welcoming and chatty, so that was good for me at that stage.
Yes. So okay, the next day pad comes off.
I think the pad came off on the few days
after.
after.
Did I give you a little bit longer? Sometimes I do, if I think it's going to be a little bit oozy.
I think this was the Friday. I think the Wednesday, I think that's when I came.
Oh, because it was a skin graft, wasn't it?
It was a skin graft, yeah.
So usually for that I would leave it a little bit longer.
Yeah. Again, just not prepared. And I was working at a vaccination centre at the time, and I thought, I just can't go home. So I went to see my colleagues, and they were all in a little bit of shock, going, we didn't think it would be that bad, because obviously we chatted about it before I went. So it was really traumatic.
I'm so sorry.
No, it's all right.
But it's a big shock to the system.
It is a big shock to the system.
And it's in a really cosmetically sensitive part.
And I never ever thought I'd look the same ever again. And as you know, I kept coming to see you, but we can talk about that in a moment. But just not prepared. And I think that's where all these young girls now going on sunbeds and not wearing the goggles. I mean, I'll openly admit, I used to turn those sunbeds on. I was under them for a long time. I didn't wear goggles. You think it's just not going to happen to me. And even I think when it did happen to me, I just was, no, it's going to be okay. So I was one of the lucky ones. I'd got you as well to help me on that journey and to repair my face for me. But not everybody is so lucky. And if I'd have left it any longer, then it would have been.
There would have certainly been more
Absolutely.
more scarring. Yeah. So one of the issues with skin grafts, which is why where I can, I'll use a flap, so I'll slide tissue across where I can. It's not always possible, especially in the upper lid. But when a graft is used, one of the downsides of doing that is that you can get a bit more scarring around it and more reaction. So I think in the months that followed that, we were then trying to manage the scarring and to try and, because it was quite tight to start with. Really and I gave some injectables into there, which I know probably was another trauma for you, of steroid and something called 5-fluorouracil, which is a drug that's used in cancers actually in other guises, but it can also be used to manage scar tissue. But the timing's really important, because you want to do it before the scar has kind of set itself in stone. So we had quite a sort of few active appointments to try and manage the scarring. But I think eventually we did get there. So after your treatment for your right upper lid, you came back to see me for some treatment on the left.
Yeah. So I had blepharoplasty, which is where they take the skin from the eyelid. Because as you get a little bit older, the skin does go a little bit looser. So actually, all in all, there was a silver lining at the end of it.
So you ended up looking younger.
Yeah, well, I hope so.
Yeah. Yeah. So it's been quite a journey. So when was that? 6th of September. What year was that?
No, I think it was 2022.
Right. And when did you kind of feel that? Because it was obviously quite traumatizing for you. When did you feel that you kind of can't say over it because I don't think you really get over trauma, but when do you think things felt more or less back to normal? When could you look at yourself in the mirror without being focused
Probably
on that?
well over a year.
Really?
Yeah.
As long as that?
Yeah, I remember in the November after we did the surgery in the April, I was still really suffering, not because I was vain, but because there was still problems with the eye. And I think I was still messaging you as well for quite some time after. And then I think you just come to a little bit of a turning point where the scar settles down, the tightness wasn't so severe. I'd say probably over a year.
Yeah. And when did you feel that you could get on the wrong side of the camera, as it were? When could you have your photograph taken again?
Again, I think it was about at least 12 months.
We have a photograph of you at your daughter's graduation. How long after the procedure?
That was only in the June.
Right. So
Yeah,
quite
so that was relatively quite soon afterwards. And then I remember us going away in the November and just thinking, I can't bear to look at those photos because I was swollen quite a bit as well, and because of the tear ducts as well that were affected, it used to water quite a bit. And I still get that now if I go to a hot country. My one eye really does suffer because we discussed it as well.
Yes.
That the eye doesn't close fully. So
there's still a little bit of a gap there, isn't there? And so when you are somewhere warm and your tear evaporation happens more quickly, you'll get a deluge of emergency tears sent through. So it's a nuisance, but it's keeping things safe. Absolutely. Yeah. What made you decide to put your photographs on Facebook? What made you think I'm going to do that? Because that was a big decision.
It was a big decision. One, I felt as though it was ready for me to share the photographs, and I felt I was ready to do that. And then so many people, it was when we had the really hot spell at the very beginning, and lots of people were probably going out, not putting sun cream on because they'd been in all winter. And I thought it is time really to show awareness on how dangerous it can be, because we all hear about skin cancer, but none of us really share what we went through and how traumatic and how you actually look and how you feel at that moment in time. Yeah. So.
And we were talking earlier, and unfortunately you had a friend who had a more severe form of skin cancer.
She did, yeah. So she'd had a mole on her arm since she was born. We went on the sunbeds, which I totally regret, but that didn't cause that to start so much. But we went on the sunbed. This is really itchy. So we went on holiday together as a family, and she kept catching a handbag kept catching it, and it was bleeding. So she went to the doctors, and they went, absolutely fine, because you've had it since you were a child, nothing to worry about. If you want it taken off, we will do so. So she said, it is really annoying me now. So she had it taken away, and it was a Friday night. I always remember it was a Friday evening. The doctor came to the door, and he said, I'm really sorry, it is melanoma. So she had that taken away. She had her lymph nodes taken away, but she just kept saying, I feel that there's something still there. And we were going, you've had the all clear, you're fine. She said, no, I know that there's something still there. And unfortunately, at the age of 34, after completing the London Marathon for skin cancer, she passed away.
Oh, that is really really sad, isn't it? So I think you mentioned some of the signs. So it's a mole that's changing.
Yeah.
We often see moles become darker, so they change in colour, or if they grow, if they bleed, which I believe this one did.
Yeah, so it started to bleed, and then it's slightly raised.
And itchy, yes. So the texture of that changes, and if there's inflammation around it, so you start to get a pink rim. These are all warning signs that they need to be checked out and go and see your doctor or a dermatologist. There are dermatologists who offer mole checks. I know it's not always easiest to see a dermatologist these days, but it's always worth getting the moles checked if you possibly can, particularly if you've had another skin cancer, because we know that for example, your basal cell carcinoma, that's not going to suddenly pop up somewhere else. However, because UV light, sunlight, sunbeds, it's a cumulative process. We know that you can be at higher risk of getting new ones, so you will always need to be vigilant, and if there's anything new that pops up, get it checked out, which I'm sure you would. I also advise, as I know you do now, factor 50 every day.
and in the winter?
Yes, absolutely. I would generally recommend a vitamin D supplement, 1,000 units, because the majority of people in the UK are vitamin D deficient, and we don't see a lot of sun in this country. So I think if we're covering up our sun exposed skin to protect it from cancer, it's not going to be making vitamin D for us. So that's important. Something else that has been shown to be effective for preventing skin cancer is vitamin B3, or sometimes called nicotinamide or niacinamide. 500 milligram capsule twice a day has been shown to reduce the risk of skin cancers in people that have already had it. These are non-melanoma skin cancers, but that's also worth knowing.
I didn't know any of that. Thanks.
Yes, supplements are unfortunately not available on the NHS, and usually you have to go online for vitamin B3 because it's not as readily available. But there is good evidence now that it's helpful. And what's interesting is that vitamin B3 is popping up in a lot of cosmetic supplements because it's beneficial for the skin. Healthy skin looks good generally, so it's probably no coincidence that you're finding it in skin cosmetic supplements, and cosmetic topical products as well will often have niacinamide in there as well, so worth knowing about. Eating lots of berries.
Yeah,
Lots of polyphenols. I know you have a really healthy diet, don't you? In fact, you had berries today.
I did have berries today.
So you've had your polyphenols. So all of that is really important. Now, I want to also talk today about, with skin cancer aside, about what you do for a living.
Yeah, so I'm a Pilates Reformer instructor. So probably in October last year, I made the decision to teach full time. I did work at a clinic in London, but the travel on the trains, and I was just having no quality time whatsoever. So I do teach now full time Pilates Reformer.
What is the difference between Pilates Reformer as opposed to, because most people understand
mat Pilates?
Yes, exactly. So what's the difference?
So it's on a bed which is similar to a carriage. The bed moves backwards and forwards, and on that carriage you've got a set of 5 or 6 springs dependent on the design of the bed, and then straps and pulleys. So it sounds all quite intriguing, I know, but probably
50 Shades.
it's a little bit 50 Shades. In fact, that's what some men think, but it's actually not. It is torture for them. And so until you see what a bed looks like, it's really hard to describe a bed. But first of all, it was invented by a guy called Joseph Pilates, and it was for war veterans who were bedbound. So he took a bed apart and he applied some springs so that the guys could pull themselves up. Obviously, they were just lying sedentary. So that's how it came about in the very, very beginning. So it encourages you to use the 3 major muscle groups. Your core, which is from here, starts right at the pelvic floor, up towards the chest, your quads and your glutes. These are the 3 biggest muscle groups that we have. But over time, everyone uses the lower back, they're using their knees. So the body is just not functioning how it should. So the Reformer beds encourages you to use your muscles rather than your lower back and your knees.
Right.
So it's all controlled and functional movements.
Yeah. That's so important, because I think those 3 muscle groups, once we start losing function, that means you can't get off the toilet, you're not capable of independent life. And I think we forget that. We spend so much time sitting these days and not using those muscle groups, and then people get bad backs. And all of these things, we're all on a trajectory, and unless we actually do something about it and intervene, there is that, you reach sort of 70 or 80 and there's a real danger that we can't manage.
Or just pulling yourself. If you're on holiday, you go out on a boat trip and you can't pull yourself out the water. So it's quality of life as well as everything else.
Yeah, absolutely.
So giving my little bit back to the to the world.
Yes, and going way back, your personal journey. And your decision to become a fitness instructor, you actually had a very serious accident, didn't you?
So and I don't think many people have been rolled over by their own car, but that actually happened to me.
Your own car?
My own car, on my own drive. So
that sounds a bit careless, Jane.
I was kind of a little bit careless. It was it had been involved in an accident some time before. They should have really written the car off. I was parked on my drive, and unfortunately my drive was on a little bit of a slope, which would never buy a house again with a drive that's on a slope. I was putting my son's buggy away. He was only 1 at the time. My daughter was in the front singing Reach Up for the Stars, which could have been very problematic. But anyway, I slammed the boot, putting his buggy away, thinking it'd be awful if the car started to roll or move. And it started to move. Well, my immediate reaction was, my children are in the car. I have to stop this vehicle. It wasn't, oh, let me think logically, it'll hit the curb.
You actually tried to stop it.
So I tried to get in, and the handbrake, or it come out of park into neutral. So I tried to do that, but then the door knocked me over. I fell onto the floor. It went over my knee. So it damaged my knee, it fractured my pelvis, it fractured my S1, S2 level, so that's here in the back, for those of you that don't know. It broke my ribs, punctured my lung, and then damaged my face.
Wow.
Then I passed out because of the pain, and when I came through, I thought, I can't walk and I can't see. It was completely darkness. It wasn't as if, my eyes, I couldn't see because of glasses at the time. It was complete darkness. I couldn't move my legs, and I just thought, that's it.
Terrifying.
It's over. And then the helicopter came, the helicopter ambulance. As soon as I started going into that, my eyesight started coming back. And they just said that once your body goes into severe trauma, your body shuts down completely. And you're like a little machine inside. That everything is going to save your life, basically. So anything that is not needed at that time shuts down. And all the other functions start moving to actually save your life. So this happened on the Friday, and I was in intensive care, thinking I wasn't alive all weekend. Really annoying the staff, because I had to touch someone, because I even felt as though I should not be alive right now with what's just happened. So I had to feel the warmth and the touch of the nurses, which kind of got on their nerves, I think, after a couple of days. But then on the Monday, I walked out.
That's amazing.
And they went, this cannot be happening. You should not be alive, for one, and you should not be walking out of here. I wasn't walking, running.
No.
My body was in absolute agony.
But was that because you were fit before you had the
And they said if you hadn't have been physically fit before that happened, then the outcome might not have been the same.
And do you think that changed your kind of career trajectory?
It did, yeah. I think all of us in life were put on the planet. We're all put on the planet for a reason. And I think unless you do something to help others, then what's the reasoning being? I think we're in different industries, but the amount of people that you help on a daily basis, for me, for example, if I hadn't have had you as my consultant, I dread to think what the outcome have been, so thank you for that. But I think we're all on this planet to make a difference. So
it gives you a reason to get up in the morning as well, doesn't it?
Yeah.
And really, having a sense of purpose, absolutely.
So that's what's really driven me into Pilates Reformer. Because I have a lot of ladies come in that go, it fixes your back. It doesn't fix your back. Once your back is broken, once you've had a really bad knee injury, you can't fix that because it's broken. But what we can do, we can fix the muscles around those joints. And when they're stronger, then that supports maybe a broken back or maybe a damaged knee, or
I suppose it stops other muscles compensating that then can develop problems in
often
other areas.
you might have one side that's stronger than the other, or the muscle might be more pronounced than the other. But as long as those muscles are nice and strong, then your body just works so much better.
Absolutely.
So yeah, it was again another long journey. So but hopefully I'm helping other people to lead a much healthier and brighter life by coming to my classes.
Yes, well, I'm looking forward to coming and doing a class with you. We're going to do a little bit of videoing.
I'm really looking forward to you coming. Yeah, really looking forward to you coming.
So yes, I can't wait for that. And I actually think that I've been having a few issues with kind of a bit of shoulder impingement. So I think also I like the idea that it's very controlled, isn't it? So the risk of injury, particularly, for more mature ladies like me, it's important, obviously, not to risk injury. So yes, I'm really looking forward to that. So thank you.
I think because I have had so many injuries, I understand completely when people come in with certain injuries. So that helps. A little bit of life knowledge helps with anybody that's injured. So I'm really looking forward to you coming.
Yes, me too.
Really looking forward.
So, and I've been really looking forward to speaking to you today. Thank you so much for coming. It's really been fun and informative. I will see you very soon in the Reformer Pilates class.
We'll be doing it at Chalk, which is in Church.
Okay.
So that's a newly open studio.
Yes,
really
I think they've got
beautiful
a
studio.
health and well-being,
Health and
interest there as
well-being,
well.
a little bit of an aloe vera shot before you do your class. So yeah, a little bit of health and well-being as well.
Sounds wonderful. Thank you. I'd like to thank Jane very much for coming along and talking to me today about her quite traumatic and very personal journey. If you've enjoyed the content today and would like to listen to more of our health and wellbeing podcasts, then you can find them on YouTube, via my website, or via askwisewomen.com. Until next time, thank you.